Group 5 has completed a population and community health assessment for Guilford County, North Carolina. Group members are Kristen Coley, Tracy Delahunt, Elizabeth Gower, Patricia Harder, and Tiffany Wall. We have completed a windshield survey, interviewed key informants, and performed secondary data analysis to form a community health diagnosis and outline interventions to assist in addressing the issue of the lack of mental health care and resources for African Americans within this county. The purpose of this assessment is to examine why African Americans in Guilford County are not receiving adequate mental health services, identify the strengths and weaknesses of the community resources for this population, and provide interventions that can increase the knowledge, comprehension, and application of resources for mental health services among this community. The Guilford County Health Department created a health assessment team in 2016 to conduct a health assessment survey for the county. This survey identified 4 major health issues for the county, and they are listed below. Behavioral health was listed among these, with nearly 25% of Guilford County residents reporting signs or symptoms of depression or anxiety. These findings were what helped our group determine that African Americans within Guilford County were an underserved population within this community. Guilford County is nicknamed the Piedmont Triad and is the 3rd largest populated county in North Carolina. The 2 major cities of the county are Greensboro and High Point. Other towns include Stokesdale, Oak Ridge, Colfax, Summerfield, Brown Summit, Monticello, McLeansville, Sedalia, Wissett, Jamestown, Climax, and Pleasant Garden. The population distribution is listed below, with African Americans making up 33% of the county's population. Other minority groups in Guilford County include Hispanics, Asians, and Native Americans. The windshield survey identified that Guilford County has a population of around 512,000 people and has approximately 1 mental health provider for every 388 people. The highest employment industry is healthcare and social assistance. These are the 2 main areas that are responsible for providing resources and treatment for community members suffering from mental health issues. Other demographic statistics discovered through the windshield survey include the fact that in 2014, the 4th leading cause of injury deaths was from suicide. The discovery that approximately 7.5% of households have no motor vehicles and 34.77% of households in Guilford County are in substandard conditions allude to the fact that poverty is also an issue among African Americans in Guilford County. Guilford County had the largest rural growth in North Carolina from 2010 to 2014, which has led to an increase in restaurants and shopping centers, which has increased job opportunities. The county also offers several opportunities for higher education, with the University of North Carolina at Greensboro, Greensboro College, and Strayer University all being located in the area, with each having satellite campuses in the more rural areas for opportunities for online learning. Public transportation is available in Guilford County, with the Piedmont Authority for Regional Transport, Greensboro Transit Authority, and Hi-Tran being the 3 major providers for the area. The Guilford County Department of Transportation provides transportation and mobility services through their TAMS public transit system to serve populations in the county who do not have access to the major transportation providers for things such as medical appointments, employment, education, senior services, nutrition sites, and adult daycare. There are varying types of housing within Guilford County, but the major forms of housing include mobile home parks, townhome or apartment or condominium communities, and single-family subdivisions. There is a large homeless community in Guilford County, with the most being localized in the downtown Greensboro area. Luckily, Greensboro offers around 13 homeless shelters for women, men, and children. Guilford County has various healthcare facilities throughout all rural and urban communities, with around 11 hospitals and 25 urgent care facilities. Cone Health System is the largest private employer of the county and provides 5 hospitals, 3 urgent care centers, and over 60 provider offices within the county. Local mental health resources include Sandhill Center 24-call center, 6 facilities that offer free services, and 9 providers who take Medicare or Medicare sliding fee, and several others that offer services through self-pay and private insurance. One of our key informants for this assessment was a social worker with the Moses Cone Inpatient Behavioral Health Clinic. His name is Rob, but wished to not share his last name. Throughout our conversation with him, he was able to inform us that the greatest barrier for African Americans in Guilford County in terms of seeking and receiving mental health services was the lack of finances, transportation, and support of family or friends. Rob also informed us that majority of the patients seen at Moses Cone are those of low socioeconomic status and are suffering from schizophrenia, schizoaffective disorder, substance abuse psychosis, and thought disorders. This still leaves a large gap in treatment programs available for anxiety and depression. Our second key informant was Keith Funderburk. He is a community leader in Guilford County who co-owns the Social and Emotional Learning Group. Mr. Funderburk informed us that depression and anxiety are the most common mental health disorders that he sees in the community, and this is mostly due to the stressors of daily living such as lack of jobs, home life, and family dynamics. Although Mr. Funderburk and his group strive to empower others with practical skills to handle life's issues, he has had a difficult time finding resources within Guilford County and says that church communities are his greatest allies in reaching people. According to the National Alliance on Mental Health, African Americans are 20% more likely to have serious mental health issues than the rest of the population. These include depression, anxiety, PTSD, and ADHD, among others. Problems that increase African Americans' probability and/or risk for developing a mental health issue are the fact that 40% of homeless population are African Americans and the increased exposure to violence, which leads to higher rates in PTSD, anxiety, and depression. Other cultural issues that African Americans face that increase their chances of developing a mental health issue and/or not seeking care for mental health issues include that African Americans face greater shame and stigma from their cultural and spiritual beliefs associated with seeking mental health care, which also leads them to leaning more on faith, family, and friends and social communities rather than seeking professional help. The lack of information about resources are lacking for African American population, and distrust of the healthcare system due to prejudice and discrimination are also barriers. Higher rates of lower socioeconomic status, which leads to 19% of African Americans having no insurance, and also higher rates of incarceration are also reasons and barriers for health disparities for African Americans. On this slide, we will discuss strengths and weaknesses of Guilford County. The first strength we discovered regarding our health diagnosis is the fact that Guilford County offers public transportation. The limitations that the public transportation system faces is the fact that the TAM system for outlying communities requires an application for eligibility, a prearranged reservation when you need the service, and a 40-minute scheduling window, which could lead to folks missing appointments and/or changing their mind about seeking care. To help alleviate some of these limitations, Guilford County could provide a larger budget for more bus drivers, and local churches or individuals could volunteer to provide transportation for people in need. The second strength was that Guilford County has a lot of involved community leaders. One of our key informants is a well-known community leader among the African American population in Guilford County, but faces many limitations in the fact that he has limited access to resources. He also has a hard time getting others to be involved with reach-out programs and an ever-increasing need for supplies. Community resources that could help alleviate some of these barriers is for more African Americans to step up and volunteer, and colleges and universities in the area to promote education to focus on programs in related fields for mental health care. The third strength that we identified was the fact that Guilford County has 7+ facilities that offer mental health services with an abundance of practitioners that offer outpatient services. The limitations with this strength, however, is that majority of the inpatient units have wait lists, low funding, are overcrowded, and face understaffing issues. To help alleviate these barriers, policies and legislations must be changed, and advocacy is needed to increase funding to allow volunteering from community members without having to jump through tons of hoops. The weaknesses discovered throughout our assessment include lack of knowledge regarding resources, lack of preventative programs, and lack of diversity among mental health care providers. During our research, our key informant stated that finding resources was easy, but reaching someone was more difficult. This relates back to the understaffing and increased caseloads for facilities. We also discovered that majority of the inpatient programs only provide services for mental illnesses patients do not really accept people with mild anxiety or depression. Also, both key informants, as well as pictures found of mental health care practitioners in Guilford County, alluded to the fact that diversity is lacking among providers. Majority of the providers are white females, and research has shown that African Americans are more likely to receive and believe information is relevant to them when it comes from someone who looks like them. The 3 community nursing diagnoses that we formed as a result of our assessments are deficient knowledge related to lack of education and ease of access to mental health care resources for African Americans in Guilford County, as evidenced by increased rate of African Americans diagnosed but not treated for anxiety and depression. Hopelessness related to stigma and shame among the African American community in Guilford County, as evidenced by cultural and spiritual beliefs popular among this ethnicity. And lastly, ineffective community coping related to overpopulated mental health facilities in Guilford County, as evidenced by understaffing and poor funding for mental health facilities. Our interventions that were created after developing appropriate nursing diagnoses and identifying the strengths and weaknesses within the county are listed below. The primary ones are to educate. Ways we can do that are by creating pamphlets and handouts with pictures of other African Americans and distributing them in community centers, barbershops, and churches, which is the first step of reaching this community. Also, providing advertisements with phone numbers and websites such as the Sand Hills Call Center, and then ensuring that these ads are available via social media and/or mobile apps will help reach younger adults. The second primary preventative strategy that we could implement would be to work with local community leaders such as ministers to create informational workshops or seminars to discuss signs and symptoms and to decrease stigma and shame. Secondary and tertiary interventions are listed on this slide. Our secondary interventions could include holding community clinics or mental health fairs to provide free and quick screening so that early signs and symptoms can be recognized, and having providers on site to discuss the next steps for making an actual diagnosis. Tertiary interventions would include ongoing monitoring of medication and therapy adherence throughout the community by starting initiatives to provide monetary support and transportation services for those who may not have the means to provide it for themselves. Listed below, you will see our references for this project, and we hope that these can be implemented within Guilford County with the help of some of our key informants and local legislation changes. Thank you.